So these are the two conformations of thalidomide. This first one is called R-thalidomide. And the second one is called S-thalidomide. The main difference that you'll notice is in this bond right here. And so for the R, it's a wedge, and in the S, it's a dash. But for the purposes of the things we're talking about, it was involving the R-thalidomide. So the first thing that we're looking at is this left ring right here. And this left ring is what caused the teratogenic effects. And that basically meant that was what caused the limbs to be deformed, and that also caused the mental handicaps.
So the teratogenic effects were a huge negative that ruined the lives of many babies. The companies back then did not see the failure of limbs as a realistic side effect for the drug. Here's what they missed. After the fact, they did testing on the drug and tested for metabolites in chick embryos. They noticed that there were issues with the wings developing properly. CPS-49 was a metabolite that was killing the blood vessels. When these blood vessels died, the limbs could not form properly. Limbs develop relatively late in pregnancy, about 23 days after the impregnation, which is why they were the most severely affected. As for mental handicaps, the blood vessels in the developing brain were also affected because the brain starts to develop earlier on. They only resulted in handicaps like dyslexia, epilepsy, or autism.
And then looking at this right side is what was a sedative. And because it was a sedative, that was what calmed the nausea in the pregnant women.
The whole reason birth defects happened in the first place was because thalidomide had such great effects on pregnant women with awful morning sickness. It was originally developed for insomnia, so it acted as a sedative. As a complementary feature of being a sedative, it helped women with morning sickness by acting as an anti-nausea medicine.
It also is an anti-inflammatory on this right side. And because of that, it was able to fight leprosy.
On that left ring, thalidomide acts as a strong anti-inflammatory, which is really how it helps fight leprosy. Thalidomide changes the way the body responds to the bacteria responsible for the inflammation in leprosy. This bacteria is called tumor necrosis factor, or TNF for short. So the thalidomide's anti-inflammatory effects help reduce TNF and change the way the body combats this bacteria.
So just to cover the main things again, what you really have to remember is that this left side was what was responsible for the teratogenic effects, which caused the deformations in the limbs and the mental handicaps. And this right side was what was responsible for making it a sedative, which resulted in calming the nausea, and it was also an anti-inflammatory, so it could help fight leprosy.